Good evening, it's 8 o'clock. The top headlines tonight. India is now second in the world in its daily rise of cases. The centre says today the situation is going from bad to worse. Mumbai, Delhi, Bengaluru amongst the worst hit districts of India. The Mumbai Commissioner says the city is likely to hit 10,000 cases a day soon. Meanwhile, a holy COVID surge in key UP districts. Just look at those celebrations. And from Bengaluru, ICU beds filling up once again. But it's politics as usual in the election states. It's Chief Minister Mamata Banerjee versus Home Minister Amit Shah and roadshows in Nandigram today. The Prime Minister campaigns in Kerala, Tamil Nadu and Puducherry. Priyanka Gandhi also begins a two-day Kerala campaign. Controversial cop Vaze's latest case diaries. The seventh car linked to him is found. From expensive cars to hotel suite, the NIA claims all of them are linked to Vaze. April 1st deadline for current automatic payments. Now, one more authentication mandatory by the RBI. Cyrus Mistry's first response to a Supreme Court verdict favouring Ratan Tata. He says, I sleep at night with a clear conscience. Our lead story tonight, well, as Vishnu is reporting, the latest figures show that India is now number 2 in cases globally. Remember, India in the last months had gone down. It wasn't even in the top 5. It's now back at number 2 in the rise in cases in the last 24 hours. Today, in its press conference, the Health Secretary and the centre talked about how the situation is going from bad to worse. Here are the details.
Mumbai, Bengaluru and Delhi, which is technically more than one district, are in the government's list of top 10 districts with the most active cases. However, Pune remains the worst hit district with almost 60,000 active cases, while Mumbai has over 46,000. All the non-metro towns in this are in Maharashtra. So today the centre called for saturation of vaccination for priority age groups in districts reporting surge in cases.
कि आप सब जानते हैं कि आपके राज्य में किन जिलों में नए केसेस का सर्ज देखा जा रहा है। उन जिलों में जो एज स्पेसिफिक प्रायोरिटी ग्रुप्स हैं वैक्सीनेशन के लिए, उनका सैचुरेशन कवरेज हो, इस पर आप ध्यान दें।
Last couple of few weeks, the situation is becoming from bad to worse, and it's serious cause for concern.
However, there's still no clear explanation for what explains the second wave and why it's steeper than the first.
कोविड एप्रोप्रिएट बिहेवियर को इन्फोर्स किया जाना चाहिए, और इन्फोर्स किए जाने का अर्थ ये है कि आपके पास जो भी संसाधन हैं, आप परसुएड करें, कम्युनिटी के इन्फ्लुएंसर्स का इस्तेमाल करें, कानून का इस्तेमाल करें, फाइन करें, जो भी आपके पास साधन हैं, उन सभी साधनों का उपयोग करते हुए ये सुनिश्चित करें कि लोग मास्क पहनें।
The government data downplays the role of COVID strains. Firstly, the total number of samples tested for variants are only up by 277 in the last 1 week. In all, there are now 855 cases of UK, South African and Brazilian strains. In the last 1 week, cases of the UK strain are up 71 and South Africa up just 13. In contrast though, the Punjab government says that the UK strain has been found to be more prevalent there and that 85 cases were detected out of 95 samples most recently. As regards the novel double mutant strain identified in India, the government today played that down as well.
There is no Indian strain as such. Just add one point that mutations are sporadic and single mutations are not found to be dominant in any particular area in India.
The government has said that the COVID situation in the country has gone from bad to worse given the rise in cases and surge in infection. In a letter written from the centre to the states clearly mentioning that any complacency at any level at this stage will have heavy costs. In New Delhi with camera person Xavier Thomas, Shonakshi Chakravarti for NDTV.
And also the worry that India now driving up cases globally, the rise in this. Vishnu breaks down those figures. Vishnu.
It's absolutely shocking at this case. Who would have thought that, we would have been up at this number of 56,211 in a period of 1 month. We are now number 2 in the world. 68,566 is where the United States is. In the last 24 hours, this is where India is, 56,211. These are the numbers that we see. How is it possible that these numbers have actually happened in the period of the last 1 month at this rate? Now, the states with the highest positivity rate, and when we talk about positivity rate, what exactly does it mean? It means that what percentage of all of those who have tested have actually been diagnosed COVID positive, either through RT-PCR or the rapid antigen test. And in Maharashtra, it's a whopping 23.4%. Now you compare that with the other states, 8.8, 8.2, 7.8, 2.5, but this number itself is a huge concern. It is way ahead of what a lot of people believe that it should be under any circumstances whatsoever. And what is India doing as far as vaccine shots are given? Now, if you look at the number, it is actually quite impressive at 6.1 crore. But if you look at it from a more realistic standpoint, is that number very accurate? Because for those who are entitled to get the vaccine per 100 cases, per 100 individuals, that rate is actually still quite small. We are a large population. But over here, you can actually see it tapering off. Now, if you take a look at the 7-day average of the vaccination drive in India, you can see that it started to taper off. And again, there are questions over here which will be asked about vaccine hesitancy. Is that the case? So it did start going up, but then it seems to be tapering off at the moment. And if you take a look at what the worldwide numbers are at this stage, India is number 3 on that list. Now, that absolute number, again, fairly impressive. But in terms of how many more we need to vaccinate and how soon we need to vaccinate them, that really remains the big issue.
Right, Vishnu, and as you pointed out as well, the issue also in Maharashtra is the high number of antigen tests. Now, they're much less reliable than the RT-PCR test, but today the Mumbai Commissioner indicated that they may now be hitting a shortage of RT-PCR tests. They're doing the maximum they can. He also warned that India's financial capital is now bracing for 10,000 cases a day soon.
India's financial capital braces for 10,000 cases a day. Random tests for COVID are being conducted. These ones at Sessions Court in Mumbai.
Testing is being ramped up across Maharashtra, not just malls and other places where there is rapid antigen testing. This is, of course, the Bombay City Civil and Sessions Court, the Greater Mumbai Court. And here also you can see litigants, and others who are going in are being tested for COVID-19 before they are allowed in.
But the antigen tests are a big challenge. And even the centre wants states to do 70% of the more reliable RT-PCR tests.
RT-PCR test preferred means of testing होना चाहिए और इसके अनुपात को आप 70% तक ले जाएं.
NDTV analyzed the data for a week till the 28th of March. This shows that about half the COVID tests are the less reliable antigen ones rather than the gold standard RT-PCR ones, which have a much higher positivity rate. So much so that if all tests last week were RT-PCR, there would be roughly 50% more cases. That is, instead of an average of a slightly under 4,000 cases daily, there would be almost 6,000 cases. Worryingly, Mumbai's municipal chief says they do not have the capacity to conduct more RT-PCR tests.
What's happening that we have certain limitation of RT-PCR testing. So if you remember last year we never went beyond 10,000. Now we are touching 23,000, 24,000 RT-PCR testing. We would love to go further also, but till the time now we have virtually exhausted our RT-PCR capacity.
While the silver lining may seem to be that most cases appear to be asymptomatic, fact is that authorities are scrambling for more hospital beds.
With false negatives, many people roam around freely, passing and spreading the virus to many more. Hence, it is important that BMC increase the RT-PCR test so that the undetected positives can be detected. In Mumbai, with camera person Praminji Rohit and Rajendra Dayalkar, this is Purva Chitnis for NDTV.
While the centre is focusing on worrying cases rising in Maharashtra, in Punjab, in Karnataka, Also, Uttar Pradesh, India's most populous state, has seen a worrying rise in COVID cases in the past week. Now, could this be linked to Holi celebrations? Just look at these visuals of how Holi was celebrated, all norms violated, and we're seeing then in many of these areas a corresponding rise in COVID cases too.
3 districts for religious tourism, and all 3 topping the list where COVID cases have shot up the most over 1 week after Lucknow. In Prayagraj, formerly Allahabad, there are 57 COVID cases, up 78% in a week. But surging, maskless crowds with zero social distancing played Holi for 2 straight days on Monday and Tuesday, despite this appeal.
इस अवसर पर प्रदेशवासियों से मेरी अपील है कि हम इस पर्व और त्योहार को उत्साह और उमंग के साथ को मनाएं, लेकिन देश की कोरोना महामारी के खिलाफ जो लड़ाई है इसे ध्यान में रख करके सावधानी और सतर्कता जरूर बरतें।
Government officials pass the buck.
जो जनता है उसका तो कोई दोष नहीं है। एडमिनिस्ट्रेशन लेके डंडा घूमे तभी आप मानेंगे, पब्लिक मानेंगी। इंफॉर्मेशन आप लोगों के द्वारा दिया गया है, साल भर से दिया जा रहा है, तो पब्लिक को ना मानना चाहिए। शिक्षा तो इसीलिए दिया जाता है ना कि आप माने।
A bigger worry in UP is Mathura at 61 cases as of Monday, but this is a spike of over 450% in just 1 week. This after 4 massive Holi gatherings with no COVID protocols.
मथुरा और वृंदावन धार्मिक नगरी हैं, तो जनता को लगता है काफ़ी दूर दूर से लोग आते हैं, ये लोग मंदिरों में दर्शन करने आते हैं, तो ये मंदिरों में दर्शन करते समय भी भीड़ अवॉइड करनी चाहिए।
In Varanasi, among the world's top spiritual destinations, fresh COVID cases are at 75. They have jumped 120% in a week.
सब त्योहारों में लोग आए हैं, घरों पे आए हैं, पॉपुलेशन की मिक्सिंग हुई है। अभी अब तक तो वेल मैनेज्ड है, बट ये है कि पब्लिक एड्रेस सिस्टम से हम लोगों से अपील कर रहे हैं कि भाई लोग अभी भी सतर्क रहें, बचें, क्योंकि प्रिवेंशन इज बेटर देन क्योर।
While the cases are still in double digits in most areas, what's worrying is the rapid rate of growth, and that, as the Prime Minister pointed out, it could spread from smaller towns to villages. With Ajay Singh, Nitin Gupta and Saurabh Gautam, this is Alok Pandey, NDTV.
So while celebrating festivals is everyone's right, do it safely, stay at home. Look at these visuals coming out of Nanded in Maharashtra, where a crowd of Sikhs with swords attacked policemen, injuring at least 4 of them after being refused to hold Hola celebrations in this area because of the pandemic. So you can see there the policemen actually running as they're being beaten. The video there going viral shows the crowds actually forcing their ways into the Gurdwara, breaking barricades and attacking the policemen in Nanded in Maharashtra. Well, moving to other cities and states, Bengaluru also seeing a worrying rise in COVID cases, and now the hospitals also full once again in their ICUs as they're almost at 100% occupancy.
This is what it is really all about. The surges, the spikes, the second wave, the rising numbers. COVID patients in hospital needing help to breathe. Here at the Ramaya Medical College Hospital in Bengaluru, of the 100 beds set aside for COVID patients, 88 are full.
We don't know how it will behave. We hope it will not be as bad as the first. We hope it will be better. We hope there will be an earlier peak and a shorter duration. We have to hope for it. In the first wave, we were a lot underprepared in terms of how the virus would behave, in terms of the PPE, in terms of the infrastructure.
In Manipal Hospital, the ICU for COVID patients has been getting busier.
We are also experiencing, some kind of a slow increase in the number of COVID cases in the ICU in the last 3-4 weeks. The reports from India say that there is an increased, involvement of young people in this resurgence of, the current surge of COVID.
In another part of Bengaluru, in the specialist hospital, 20 rooms have been set aside for COVID patients. All are full. But there is more optimism this time among the medical staff here.
We have seen a steady rise in the number of COVID patients. We noticed this around the first week of March. It just came with a bang and now the cases are rising. Compared to the first wave, I feel we are in a much better position to handle this crisis simply because now we have a set standard operating procedure.
The rising numbers in Bengaluru have been described by the state government as alarming. And once again, the COVID warriors in PPE kits are ready for the fight. Maya Sharma in Bengaluru for NDTV.
Tragically, again, those all too familiar visuals of packed ICUs and doctors and nurses on 24-hour shifts. But it's politics as usual in the election states. While the Election Commission has laid down strict norms, have a look at what's exactly happening today, of course, in the most keenly watched constituency in this election of Nandigram, where the Chief Minister is contesting. It was Mamata Banerjee versus Amit Shah.
Last day of campaign in hot seat Nandigram. Mamata Banerjee on a wheelchair padayatra, sandwiched between high-voltage road shows for her rival Shubhendu Adhikari by Amit Shah and Mithun Chakravarti.
নন্দীগ্রামের মানুষকে আমি একটা কথা বলে যাই, আপনারা কি ভয়ে গুটিয়ে যাচ্ছেন? আমি তো নন্দীগ্রামের মানুষের কাছে এটা আশা করি না, নন্দীগ্রামের ভাই বোনদের কাছে আমি এটা আশা করি না। আমি জানি নন্দীগ্রাম জ্বলে ওঠে।
रोड शो में नंदीग्राम की जनता ने दिखाया है, इससे सुनिश्चित है कि बहुत बड़े मार्जिन के साथ नंदीग्राम की सीट पर भारतीय जनता पार्टी के प्रत्याशी शुभेंदु अधिकारी जीतने जा रहे हैं.
At an unscheduled visit to Balrampur village to meet the family of a Trinamool worker allegedly thrashed by BJP rivals and sent to hospital, local BJP campaigners hurled Jai Shri Ram slogans at her. Repeat at Tengua.
This is Tengua mode and the atmosphere is electric. These are all Trinamool supporters returning from Mamata Banerjee's rally, and on my right and in the stage, these are all BJP supporters shouting Jai Shri Ram.
Cool, cool, Trinamool, thanda, thanda, cool, cool. Our vote today Jaya full. Dikase, Mata thanda, 48 ঘন্টা মাথা ঠান্ডা, ভালো করে ভোটটা কেড়ে করে নিন, তারপরে পান্ডাদের সব অধিকার কি করে কাটতে হয়।
Both sides have rolled up their sleeves for 1st April, the mother of all battles in the war for Bengal. In Nandigram with Giri Shankar, Mamata Banerjee, NDTV.
And Prime Minister Modi today on the campaign trail in the south, rallies in Kerala, Tamil Nadu and Puducherry. Also from the Congress, Priyanka Vadra began her two-day campaign in Kerala.
For many years, the worst-kept secret of Kerala politics was the friendly agreement of UDF and LDF. Now, the first time, voter of Kerala is asking, what is this match fixing? 5 years, one loots. 5 years, the other loots. Judas betrayed Lord Christ for a few pieces of silver. LDF has betrayed Kerala for a few pieces of gold.
When the BJP and the RSS make hollow statements about protecting women, it is a farce because they don't respect women.
Well, a quick look at some other news. More evidence, this time a 7th car, which is apparently linked to controversial police officers such in Vaze. This has emerged in the investigation into the murder of Mansukh Rain and the Ambani residence bomb scare, which the Central NIA agency is investigating. 7 cars have been found allegedly linked to the case and being used by Sachin Vaze. All of them extremely expensive foreign-made cars, this including Land Cruisers and other expensive cars. Well, a quick look at other news. The deadline for linking your PAN and Aadhaar card is tomorrow. If not linked, the PAN card is likely to become invalid, and one may also be liable to pay a penalty of 1,000 rupees as per the latest finance bill, which was passed last week in Parliament. Meanwhile, the other big focus, of course, will be that now your current auto payments, the payments you are deducted from your bank accounts every month, will be stopped, as the RBI has now asked that from the 1st of April, there be an additional authentication layer.
Your standing instructions for bill payments, streaming services and more might start failing come April 1st as the new RBI mandate comes into play.
Streaming services are all about the conveniences, and not having an automatic payments adds a layer to the process. Till the issue is resolved, I will still look into linking my UPI.
Banks have now started sending notices to customers requesting them to complete transactions directly and notifying them about the disruption in services ahead of time. The RBI circular first issued in December 2020 states that all recurring transactions using cards and prepaid payment instruments will now require an additional factor of authentication. A notification will be sent to customers in advance before an automatic payment is scheduled, and the transaction will go ahead only once approved by the user. Transactions above 5,000 rupees will require an additional one-time. Major banks like SBI, ICICI, HDFC and Axis, however, claim that they are not ready to implement the new system. The new system requires close coordination between the bank that has issued the card, the bank acquiring the transaction, as well as the payment processor that handles the e-commerce transaction. Banks are expected to decline all such automatic payments, and users will have to make annual transactions to complete bill payment. The ruling, however, does not affect UPI transactions. While the central bank has refused to extend the deadline, the matter is expected to be resolved in the coming weeks. For the moment, however, you should be prepared to make your bill payments manually or risk defaulting on your subscriptions. Rubina Mungia, NDTV.
Former Tata Sons chief Cyrus Mistry has responded to the Supreme Court verdict last week, which favoured Ratan Tata, saying he's personally disappointed by the outcome of the judgment. He says, at Tata Sons, I had the opportunity to work with a fantastic team of people. Although I will no longer be able to influence the direction of governance of the Tata Group directly, I hope the issues I have raised will cause deeper reflection and influence individuals concerned to catalyze change. He added, I sleep with a clear conscience.